All right, now, so we were saying in the back here, this last little section, we gave you the young lady to follow. We told you that this is the test plan. Which two do I have highlighted? Safety and infection, and what else? What else? No, what else? Psychological. Now, you did what everybody do, which is confuse this for that. Reading is fundamental. Look at what you're reading, precious babies. Psych, 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 psych. Here's my little admonition for psych. Notice at the top you start with it. Notice at the bottom you finish with it. Psych will kick your ass, especially if you are an English second language student. Psych will tear that ass up because the way we do psych in America is so different. So psych, 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 psych. Start with it, finish with it. And then you'll notice the safety and infection control is highlighted as well. The reason for that is your test has put more safety and infection control on this exam. More than likely, well, not more than likely, I know for a fact one of the reasons why they did that is because of the group of ignorance and stupidity and craziness on social media was quite a bit of nurses, of the group of people just being stupid on social media and showing lack of knowledge were nurses during COVID. So whether it was a vaccine or how it's transmitted or what to teach or what PPE to wear, a large group of ignorance came from nursing. That was shocking to the Board of Nursing. So they decided to add more infectious disease concepts to the test in hopes and prayers that your level of intelligence will reach as high as your physician colleagues. Okay? Which is your partner in crime. It's not, you're not underneath them. You are lateral. You are equal to them. And your intelligence must match theirs. Okay, so that's why these two are on here highlighted. That is precisely why, because they added more infection control, and then psych is very difficult. If you look, it's the only subject they pulled out of all the different subjects. Even that little sheet on the wall there, on the back, you see it says digestive system, endocrine, circulatory, human, whatever. Out of all the body systems, cancer, out of neuro, out of respiratory, renal, they chose to pick one subject and pull it out and put it by itself. Because no matter where you work, you're going to get up against cray-cray. Whether it's the people you work with or the patients you're dealing with or the family members that come to support those patients, you're going to deal with cray-cray all day, okay? So that's why this is back here. This is your last step. Now, there is a video, and you need to write down at the bottom, 1 week before your test. Write it at the bottom. 1 week before your test. Watch that video that says 1 week before your test. Literally, there's a video that says 1 week before your test.
Did you just put it up here?
No, it's been out for a long time. It's in the NGN NCLEX self-study list. It's in that. If you are able to pull up your playlist for the actual HETV, we will help you make sure you know where that is. This is a good one to watch before your HESI test as well. So you just go to HETV, put that in your search. When you get to HETV, click on the logo. And then at the middle of your phone, you should see a playlist. It says Home Video Shorts and Playlist. Did everybody find it? Yes. Take your time. Make sure you get it, every single person. Because everything you need is in the playlist. Everything. So you want to remember that we always use the playlist to find the video. And I'll show you what section it's in. Everybody on playlist? Yeah. Okay, what's the first playlist?
2025 Money Matters for Nurses.
What's second? Okay, then you see the NG and NCLEX test plan, right? Yes. Now, that NG and NCLEX test plan, FYI, is everything about each and every one of these, what to study in every single one of those subjects, how you study for each category, okay? Then if you go down and keep scrolling, you'll see management of care, you'll see reduction of risk, you'll see fundamentals, you'll see basic care, and right under basic care, what do you see? NG and NCLEX. You'll see a picture of an RN and LPN lettering, right? That's to remind you of the question I get so very often. Two questions I get all the time. Is this for LPN too? And then the other question is, will this help me pass my HESI? And to that I say the same thing. Did the human body change because of your licensure? No. Did your HESI change? No. Because of your test changing, like HESI, ATI, NCLEX, didn't the heart still pump the same way? Didn't the brain still act the same way? Didn't a seizure still show up the same way? Isn't it still illegal to not round on your patient? Isn't it illegal to let them escape from a nursing home and freeze to death and now you're arrested? Oh, okay. So then none of this changes based on your licensure or the test you're taking. In other words, think. None of this changes no matter who you are. They may change the wording, but it's still the same concepts. And let me give you an example. On the LPN exam, what is this going to be called? Coordination of care. Same exact shit. People come up here, LPN and RN, and they stand in the class and they just took their test like that week prior, and they're shocked that they have the exact same questions. They're completely shocked. Like, I've been saying it forever. You don't believe me till you do it. You have the exact same questions, you guys. Okay, so don't worry. So if you click on NG and self-study playlist, because these are all playlists, you will find real fast that 1 week before your test video. Do you see it?
It's the second video. It's
the second video for a reason. It's huge. It is your checklist. Like, okay, I'm ready. I'm ready. Now, here's the most important advice in the video. Please write it at the bottom of your Oh My God packet. Okay, so let's see what you did, honey. Sorry. Okay, get out of here. Just get out of here. Do you even have YouTube app on your phone? Huh? No. Well, that explains it. Okay, so put the YouTube app on your phone and I'm going to help you. Okay. If you don't have the app on your phone, you're going to be lost. The app itself, not me, the app YouTube on your phone, you're going to be lost. Okay? And then I'll help you, baby. Okay, so you got it? You see where I'm going with this. Now, at the bottom of the Oh My God packet, here's what you write. You must do a U-World assessment exactly 1 week before your test. You must do a U-World assessment test exactly 1 week before you test. As you know, U-World is the only software I support. I don't get kickbacks. They don't pay me. I'm not for sale. But it is the best. Now, when I say you must do a U-World assessment test before you test, remember and write it down if you think you're going to forget. That's 100 questions in one test. It comes with the U-World subscription. Do not use it in advance. You get 2 usually or more with every U-World subscription. I tell you the first one, you need to do it to see where you are and how bad you are and how far you got to go. And that's the first week you start my program, right? And then the last one you do 1 week before your test. What if, listen up, what if the score on that test is in the 60s? No. Reschedule. Here's what we know. Here's what we literally know. We know that 100% of scores in the 60s will fail. We know that. I got countless students and countless testimonies and countless consultations where you literally let fall out of your mouth that your average was in the 60s. And then I let fall out of my mouth. Makes sense now, okay? It makes sense. So you can't. There's people in here right now, they keep trying to convince me they're in 70s and 80s. And every time I try to get them to take a test, they in the 60s. I'm like, you ain't going nowhere with no 60s, period. You can't. Unless you just want to love on me for 2 more years. I don't know. But you cannot go with 60s. It's guaranteed to not be successful. And you need to think about it. Oh, good. I don't know what I'm doing. Okay, I think you got it. Okay, so I want you to know this. When it comes to, where's your app still?
I didn't hear anything.
Okay, go there again. When it comes to this test and you're dealing with 60s, let's just think through how this, you didn't open it. It's right here.
You keep going there.
What is this? Oh, look at this all messed up. Okay. Oh my. Okay, so now what do we say in real life? When, okay, this is it. There it is. Play this.
Yeah, because I've been watching.
Okay, now go down. You okay, you got it. There it is. You just had to get it on. Now, so if you click on that, you'll see it. So if you've been, if you have common sense, what is 60 in real life? It's fucking failing. What made you think you could pass with a 60? And here's what's so bad. It's not your fault. If you go to Archer, and in some cases, even UWorld, they say that's good. Oh, honey, you borderline. You might pass. What the fuck? No, you're not going to pass shit. 60% is failing in any school that I have ever seen. Now, let's think it through. 70% ain't that great. But the reason why I say for you guys, look at this. I tell the LPNs to buy the UWorld RN, even if you're an LPN. But if you're a brand new LPN that passed out of school in the last 30 days, it's basically a 70% that you need to take your test. That does not count the student who failed HESI repeatedly. You already showed you ain't learned nothing and the school was a piece of shit. Because all you got to do to know the school is a piece of shit is to see how many people pass their HESI. If don't nobody pass the damn HESI, the school's a piece of shit. Because a HESI is trying to ask, what did you learn? What did they teach? How did it go between the two of y'all? And if everybody, I done been to schools where there was nobody to pass. I have sat in auditoriums where one person passed out of 300. That tell you right there the school is garbage and that you're going to have to pump your brakes and teach yourself all over again. How many went to school and everybody failed? Everybody failed their HESI or ATI. Anybody go to? Yeah, exactly. So think about it. Think about what you're dealing with. You don't know what you don't know until you take one of these tests and find out, I don't know shit. Okay? It's a wake-up call, really. Because then you'll be like, damn, I paid all that fucking money and now they're going to be up in my ass about these loan repayments. Oh my God. It's a wake up. Okay? So there you go. Now, so that is your Oh My God packet. If you look at page 3, it gives you other tips as well, but it's really number 3 that I want you to take that highlighter I just gave you and highlight that entire sentence so you can't tell me you didn't know. How about that? Page 3 and number 3. Highlight it. That's why I came around with highlighters. Page 3, number 3. You can't tell me you ain't know. Number 7 is also important. What does number 7 tell you to do per hour? 30 questions per hour. That is huge. How many hours do you have on this NCLEX? 5 hours. How many is a total amount they could give you, the maximum? 150. If you do the division, and yes, I failed math as well, but if you do that division, you're going to come up with 30 questions an hour. Plenty of time to pass. This test is about quality, not quantity. Take your damn time. You have lots of time. In school, they were ridiculous. They made you do like a question every minute and all this other nonsense. No, go slow. The slower you go, the better it is, okay? Can you pass if you run out of time?
Yes.
Yes, and plenty of people stand up here and tell you how they did it. So you don't have to worry about time. Time is not your issue. Understanding the question is your issue. So that's why number 7 is on there. The fact that you need 30 questions, okay? Now, I want to say something about number 20. Highlight that so you know I told you that the U world is what you need. And I like number 13. Many of you, I know it sounds crazy in an NCLEX class, but I like to keep it all 100. Many of you are sleeping with the enemy.
I know that's right.
I was sleeping with the enemy as well, so I understand it completely. That person could not care less if I went to nursing school. Really would prefer that I didn't, because if I don't go, I can be on his level. That person's family did not understand why I was going to nursing school. The quote exactly was, "You got Section 8, why you doing all that?" I'm like, oh my God, what a broke mentality that is.
You don't know the quote for me, what was said to me?
Uh-huh.
Why you going to school to be a nurse? Everybody do that. Why don't you go be something different?
Oh yeah, that makes perfect sense, right? While nurses is pulling $100,000 a year, it makes lots of sense. That's fucking stupid. So, on a more serious note, in my class, I have had students whose partner, this person they're sleeping with, that they live with and love and supposedly love them, kick them right down the stairs with their book bag on their back. And I've had another young lady whose partner in crime threw her computer through the floor to crash it on purpose because she was spending too much time on that and not enough on him. So you may have a girl or a guy who really does not have your best interests at heart where this is concerned, because they're feeling threatened. The more you learn, the more you're going to pull away from them. And you have to be safe about it, because some of my students could not leave because it wouldn't have been safe, and they have since gone from that person now. But you do have to be safe about it. And not all abuse is physical. Some is straight up emotional, and it is worse sometimes than the scars I see on your arms and your face when you enter my class. So I say that because we all need to understand this is not appropriate. It is something you're going to have to figure out how to get out of. My license broke me out of this situation. Section 8 also got me out of the situation because I had my own. And so whatever way this has got to do it for you, and one of my young ladies, the one that was pushed down the stairs with the book bag, we had a safety plan. Her stuff was in my school in the back room there. She literally, the day she implemented her safety plan and her escape, she texts me, "I'm doing it today, Miss Shelley." He has the same pattern every Saturday. He sends me out there to with his kids to the grocery store. He makes his kids go with me because they come over every weekend. And when I go to the grocery store and I come back to the driveway, I'm going to send each kid in the house with a bag, and I'm going to send the 3-year-old in with a gallon of milk, and I'm going to send them into the house, and I'm going to get back in the car and run. And she did. She successfully got away, and she was so adorable and so sweet and so honest. This was her question. I almost wanted to like reach through the phone and choke her guts out. This was her question. "Miss Shelley, do you think it's bad or unethical to go to the bank and take his money out?"
No.
Bitch, what? Get that money! I said, wait, hold up. How much is there? $11,000. Get every fucking dime. You earned it. So she cleaned them out. Now, y'all know she had to move to another world before she get cut. Now, so she's gone. She's been safe for years, ever since that day. It just makes me tell you that story so that you know myself and her and others were being beat up in the middle of this journey. I get it. And so if you were like me or my baby who left the situation, you have to plan your own escape. You have to do what's safe for you. I can't tell you when or how to leave. I can only tell you, get you a safety plan and understand that, and this is probably the take-home message for your daughters, your nieces, your sisters. Once they start hitting you, they don't stop. They don't stop. They want to. Don't misunderstand their values. Understand when they say they're sorry, they mean it. They want to never hit you again. But what happened to them? Most likely they grew up in it. It's part of their DNA. It's part of their Erickson. As much as they are sorry, as they apologize through tears, as much as they promise not to do it again, it is part of their DNA. And unless alcohol and drugs are involved, the recovery rate, hear me clearly, the recovery rate for someone to stop abusing you is no better than the pedophilia rate in this country, meaning they will go back to it, okay? So we don't cure pedophilia very well, and we don't cure battery very well either. So intimate partner violence is real. As much as they may not want to do it again, very often it does happen again. And my cousin is dead, okay? So I want you to wake up to that, all right? Because I love you. And by the way, it ain't just men beating women. Y'all crazy. Y'all, there's some crazy ass women in this crowd right now. Y'all fucking loco. I done seen some of the shit y'all done did. I remember assuming that it was the man when my patient came in there pregnant, all beat up and looking crazy. I thought she looked beat up. Actually, it was just her arms that was kind of, you know, bruised. I went and asked her, what the fuck? And then she told me something crazier than crazy, talking about he out there in the waiting room. Now I'm going out here to stab him myself. I'm going in the waiting room, calling his name. He stands up and he limping. He can't hardly see. He got an eye that's broke or busted, and his lip look like it need a stitch. I'm like, whoa, what happened? Man, I don't know, Shelly. She just gets so mad. She had whooped his ass. I don't know what y'all think, but she had whooped his ass. The bruises on her arm was him getting her up off of him. And she admitted it. And I said, what? You need to be in jail doing this. You know what she said? Motherfucker should have brought his ass home last night. Okay, so yeah, sleeping with the enemy, page 3. All right, y'all get your shit together. That's all I'm saying. Too much drama, hell. Okay, now if you look at page 4, this is your checklist. I'm not at your house like I am in this class checking these students off in my class, but this is your checklist. Make no bones about it. This is it. This checklist that you see here is your job to put the date and whatever else you want to put in here, maybe your score, but the date that you completed that subject. What was the first subject? What was second? What was third? They're all 3 together. You see them? They're alphabetical. So if you go on this list, you will see on page 4, they're all alphabetical. You see the psych, the renal, the respiratory, they're all conveniently right by each other because in the first 3 modules you got to complete. Now, what you're doing is you are doing that mastery, 5 to 25 every day, all day, all that kind of crap in these subjects. But when do you actually check yourself off? When do you get to check this off? 85. When you get 85 questions and you got the score that you needed in the 85 questions, not because you did a few questions yesterday. Oh, hell no. You actually do have to master the motherfucker, okay? Now, turn to page 5. Let's find out what score you need before we go any further and do our medications. I want you to look at page 5, number 2, and look at what score do you need personally. However, new graduate RNs, new graduate LPNs, if you know it took you more than one time to pass your HESI or your ATI, you need to go for the higher score. So if a new graduate is within 30 days of graduation and she passed her HESI on the first try as an LPN graduate, what score does she need, everyone? 70. A 70%. And why is that? Because she's using RN software. So her score that she needs will not be as high as the RNs. Does that help? Okay. What do you need if you're an RN and this is a repeat test for you? 85%. Okay. Notice something else. If you were born outside of this country, then you follow the repeat RN and LPN guidelines, even if you just graduated within 30 days ago. Do you understand? Now, the week of your test, more information. Look what it says the week of your test. It says you need to do what 3 subjects? OB, Peds, and Psych. Those you're going to do the week of your exam. Those you're going to revisit because those are tricky. Very tricky. So that's a big deal. Okay? That's it. That's important. Now then, so what do? I just gave you the most important directional pages in this Oh My God study guide. Now your job is to look at this study guide every single day, page 6 on into the last part of it, because it starts with the meat and the potatoes on page 6. If you look at page 6, which one of the test plan did page 6 cover? Management of care. Because what's on there? Prioritization, delegation. Y'all see that? If you look at page 7, what part of the test plan did page 7 cover? Management of care. Let's talk about page 7 because it confuses you a little bit. Page 7 is a list of all the people to see first. Page 7 is divided up into bolder print at the top. Does everybody see how it's kind of bolder at the top? Yeah. And then it just kind of goes into normal typewritten print. The part at the top, a lot of the top part of this page is already what you just read on page 6. But page 6 put it in order. This bold print on page 7 is almost in order, not quite, but it's on there repeating to make sure you know these are the most important thing. Now, many of you in this class were taught, like I was, that ABCs were the way to prioritize. That's all bullshit.
Wow.
Yes, it's all bullshit. The most important way to prioritize, and the proof is in the pudding, you guys. How many of you guys are aware that when you take a CPR class, which is really called at the hospital level, BLS, how many are aware that it completely changed? It's no longer ABCs. Now, they changed that years ago, probably already 15. Your school ain't changed that bullshit yet about prioritizing with ABCs. But CPR did. What did they put as your number one thing to do instead of airway? Chest compressions. By the way, that's circulation. That's not airway. Wow. But they still teach you to prioritize with airway. So it's all bullshit. I am here to tell you, airway is important, but only when you have evidence of distress. So what comes higher than the airway? Ooh, look at page 7. There are about 10 words that come above anything else on your test. These, if I choose to summarize what they are, as I did on page 6 under Roman numeral 2. If you look at page 6 under Roman numeral 2, you'll see I called it behavioral changes. Those fancy dancy words like irritability, restlessness, anxiety, apprehension, agitation, confusion, altered mental status, level of consciousness, feeling of doom, those are all the words on your test that must be always seen first above everything and all things. And I repeat them again on page 7. Do y'all see that? They're right there. I repeated them again. This is who you see first, y'all. Now, the wonderful thing about this page is that as you learn these concepts on this page, this is another checkoff list. If you're actually in my class, I will literally say, go to page 7 and highlight it because I just covered it. When you cover all this, here's what you get. Physiological adaptation at its best, because now you know your disease processes. Understanding who to see first is management of care. Understanding why you did it is physiological adaptation. And all of this, learning all of these concepts on this page as you navigate through the videos, that's how you do your physiological adaptation. So I want to pull your attention to something a little bit further down on the page. Do you guys see where it says thyroid storm at the bottom, or any crisis, and then it has sickle cell?
Yes, yes.
So what I'm saying to you about any crisis is that if you see oculogyric crisis, myasthenia gravis crisis, cholinergic crisis, hypertensive crisis, thyroid crisis, your sickle cell crisis. Crisis by definition means see me first. So that's where it says any crisis. You could just take it to the bank. It's who you see first. But let me show you one more. Go in the middle of the page and look where it says RLQ, LLQ. It's right underneath impaired coworker. Do y'all see that?
Yeah, yeah. Wounded symptoms and right.
Yes, this RLQ and LLQ means pain in the abdomen, doesn't it?
Yep.
Notice how I'm saying this with my hands. This part of my body and this part of my body are way more important than this part and this part. You see what I'm doing? Because it's not just that this could be a GI emergency that could kill you, but if you're a female, it could be an ectopic pregnancy that could kill you. So it's not just GI, it's also reproductive, okay? So when you look at my GI videos, you'll see that I make you learn this thing called GLASS. And GLASS will help you know that. So just humor me. Put the word GLASS right there by RLQ and LLQ. All right, so those are just some things I pointed out. If you look at the, do you see how pancreatitis is the only bold word in a whole list of words that are not? It's in the top third somewhere, right up under the bold print. It's up under compartment syndrome. Does everybody see that? Yes. Why don't you highlight pancreatitis, because it's such a big, deadly, horrifying disease process. It will kill you. It will absolutely kill you. Okay? Now, so if you look at that pancreatitis, I want to point out something else to you that I did a little different. Go down about, I don't know, 7. You'll see something called TIA, CVA, and remember be fast. What is be fast? Neuro, but what is it?
Stroke.
It's your stroke symptoms, isn't it, guys? So if you didn't know that, that's what you want to make sure you do, is that you put your stroke symptoms. We had someone have a stroke right in this class, and a student saved her life. The update on that wonderful person is that she got her job at the Cleveland Clinic, right? So let's see here. She's quite funny. I don't know. Let's see. See what she wrote. Vet, tell the class how you doing. Whoa. What's she doing? She done call me back. Yeah, tell the class how you doing.
Hey y'all.
What happened to
I'll be
you?
here tomorrow. I'll be here tomorrow, but I'm doing good. Got a new job. I love Miss Shelly. Miss Shelly be on it.
Tell them about your stroke.
Oh, that. That was back in May, May 11th. So I stayed an extra 6 months in class so that I can get my brain back.
Yeah.
But it's back.
It took her brain, y'all. It did. It was a right-sided stroke, so it interfered
Yeah,
with her
I was crazy.
judgment.
I went crazy.
She went a little crazy. Tell them where you're going to be working.
Marymount Hospital.
Oh, Marymount, yeah.
Start February 10th.
So Cleveland Clinic, Marymount. She starts February 10th. What did you do so that you don't get in trouble at the clinic?
What, stop smoking?
Stop smoking! Yay! That is